Hello. If you had disc surgery and had a recurrence, it would be really unfortunate. Many individuals may think another surgery is necessary or if leaving it alone. If one goes to a different hospital seeking reoperation, what do most doctors say? Reoperation will be difficult. Go to the hospital where you had your initial surgery, and they reject you. This is because reoperation has unfavorable outcomes. If you have reoperation in the same area, 50% gets better and 50% gets worse. That's why doctors don't want to perform surgery that will improve only 50%. The reason why reoperation is so difficult is because there is nerve adhesion at the surgical site. The nerves are stuck together. Attempting to detach the nerve in such cases can lead to tearing, nerve breakage, or even the formation of a hole within the nerve. Secondly, a disc herniation relapse is not common for everyone. It is very rare a second surgery done because the first one went wrong. It has become a condition for recurrence. It is not due to incorrect surgery, it could be that the patient is naturally predisposed to it. Typically, the main primary cause of relapse is spinal instability. If a person has a stable and non-wobbly spine, a relapse after surgery are minimal. However, someone who has spinal instability and wobbling, the chances of relapse are significantly higher. In addition, there can be other reasons for relapses. Apart from neurological disorders, in fact, the disease has not recurred, but a disease called stenosis is hidden. For instance, if a patient had disc surgery on L4 or 5 level, and experiences leg pain or tingling shortly after surgery, further examination often reveals foraminal stenosis in the neuroforamen. Why doesn't it reveal at first and developed later? Normally disc surgery performed just make incision inside of the disc, but it should be removed disc fragments. This incision can cause the height of the disc to narrow. The disc is about the height of a finger and typically requires a width of 7 mm to 15 mm. It tends to shrink below this range. The disc can shrink from both discectomy or endoscopic procedures. The narrowing of the disc height can lead to the development of foraminal stenosis. Although it may not appear during the initial surgery, the disc shrinks over time and stenosis becomes apparent later on. When a relapse occurs, surgeons are hesitant to perform another surgery due to its difficulty and limited success rate. If disc recurrence occurs, you must visit a hospital specializing in lumbar disc reoperation, because when the disc recurs, repeating the same surgery only improves by 50%. About 25% of people may even worsen. Same approach may not be proper. It must be done in a different direction. If reoperation is performed with an endoscope, the size of diameter must be different. The direction must be different, and there is a laser called a side-firing laser, where it shoots a laser at a 90-degree angle, not a laser that shoots straight. Because the disc located above like this, it must go in at a 90-degree angle to find the problem. With a straight laser, won't be detect a lesion and it's actually quite dangerous. A 90-degree endoscopic laser is essential. Bipolar radiofrequency can avoid nerve damage because it occurs in the middle. It is a safe device, so bipolar radiofrequency is needed. Is this enough? People with disc herniation relapses need navigation because the majority of patients having an unstable spine. There's a possibility the spine must be fixated. Patients who have a recurrence due to spinal instability may need anterior spine fusion or endoscopic fusion through the side of the spine. Depending on the direction of recurrence, you need a doctor specializing in reoperation to completely change the path and fix it in a different way. Disc revision surgery cannot be done alone. It must be a team effort. It takes a team of at least 3 specialists to fix it correctly. Abdominal surgeon, cardiothoracic surgeon, and a neurosurgeon who can examine the nerves closely. Having a team of different specialists working together is crucial for a successful reoperation. Wooridul Hospital has been established in Dubai and it has become the best hospital in the Middle East. It has become more famous than the University of Cleveland in the United States, and more famous than German hospitals. Dubai Wooridul Hospital has successfully performed revision surgery on those who had unsuccessful spinal surgeries. Patients who had surgery in the US, Germany, the UK, or the Middle East experienced a relapse. When they sought treatment in Germany, their condition remained unresolved. In the UK, they were informed that the issue could not be fixed, so they came to Wooridul Hospital. Because we carried out a different surgical approach, we were able to cure these patients. Last week, there was a patient I carried out a reoperation on. 3 of us worked together. He was a 42-year-old bachelor. After undergoing a previous surgery, he experienced paralysis in his ankle. He wasn't able to use his ankle anymore. He couldn't even walk anymore. He couldn't work either. So he was in a situation where he had to have reoperation. He had his first surgery done endoscopically. He had a UBE surgery, which is a 2-hole endoscopic surgery. A very simple disc rupture or a simple case of stenosis can be improved with UBE. But when it's as severe as this case, in which there is paralysis, you should not undergo UBE. But after his UBE surgery, at first he had some improvement. Because they removed the ruptured part of his disc, his pain went away, but there was paralysis. So in this case, the problematic bones must be carved out microscopically. Once the problematic bones are removed, the spine will start to wobble and be unstable. So, we have to fixate the lumbar spine. Ultimately, this patient's paralysis was improved considerably because reoperation wasn't done in the same approach. The reason this person survived was because he came to a hospital with a team specializing in reoperations with new surgical methods. Herniated disc revision surgery is extremely difficult. It requires a team of specialist doctors and addressing the root cause through causal treatment. As a result, you should find a specialized hospital that has the system, equipment, and materials needed for successful reoperation. Thank you.